request all the participants to switch on the cameras. Everyone, please switch on your cameras. So, good afternoon, everyone. My name is Akanksha Mane, NSS volunteer from Saraswati College of Engineering. I welcome you all to this webinar. Our topic for today's webinar, as we all know, is cervical spondylosis. Cervical spondylosis is increasing in computer engineers as they have to work on computers and due to their sitting position or posture for a very long time. And as from the lockdown, we all are working from home or either attending college lectures, we might also develop the risk of cervical spondylosis. To put light on this topic, we have with us our guest for today, Mr. Shubham Dhamanikar, Ms. Manasi Angre, Ms. Sushma Valande. All of them are medical students from and are studying in Bharati Vidyapit College, KHARGHAR. I request you to take over from here.
Good afternoon, everyone. Myself, Shubham Dhamanikar. I am nurse. My voice is audible?
Yes.
And slides are visible, no?
Yes.
Okay. Today, myself, Shubham Dhamanikar. I am from Bharati Vidyapit Nursing College. We are arranging this seminar on the topic of cervical spondylosis because in today's period, due to pandemic and due to lockdown situation, everyone is in their home and joining lectures by computer or phone, maintaining the same posture for more than 3-4 hours. That is not good for our health. That's why we are arranging this seminar. Okay, first we will understand what is cervical spondylosis. Cervical spondylosis is a common degenerative condition of cervical spine. It is a wear and tear of cervical vertebra. The cervical spondylosis is also called degenerative cervical arthritis. Arthritis is a disease of bone or joint. The inflammation of joint caused due to any stress or pulling effect. Okay, the neck is the main organ where it is affected. The term spondylosis means the spine. Because it occurs in the spine, the name is given by cervical spondylosis. The neck pain is the very primary symptoms, which is get more severe and severe day by days. It has become one of the public health problem among adolescents and the causes sickness that could disturb nation's economy. This is an age-related disorder, but due to our habit, it causes in the adolescence period. Okay, the incidence rate of cervical spondylosis, because of that we are conducting this study, is cervical spondylosis is primary age-related disease. It is mostly seen in the older patients, but nowadays it is seen in normal age between 25 to 45. The more cases are coming in front of us. If you compare with the 70 years, 100% men are affected with the disease with some degree of a cervical spondylosis. Pain in the neck, it shows the cervical spondylosis is started with. In some patient, it is get severe and severe, and this disease is non-treatable. That's why we are spreading awareness about that disease. And in women, 96% are women affected with the cervical spondylosis. Cause of living pressure, cervical spondylosis has shown trend of younger. Incidence of cervical spondylosis is common in women than in men due to female reproductive hormones, that is progesterone and estrogen. Because of that, after menopausal period, the cervical spondylosis and the bone density will be changes in the woman. That's why women are more prone to the cervical spondylosis after menopausal period, that is 45 age. Okay, international incidence is 2.5 cases per 1,000 patients, and in Karnataka study shows the incidence of 7.25 cases per 100 population. Okay, next we'll be started with Ms. Sushma Valande.
So good afternoon, everyone. My name is Sushma. We are going to deal with anatomy and physiology of cervical spondylosis. M- my voice is audible to all of you or not?
Yes, it is audible.
Okay, so we will continue. Cervical vertebrae are placed one above the other with a cartilage in between each of them. They are held in position by the various neck muscles. There are total 7 cervical vertebrae in the human body. The cartilage between the vertebrae are flexible in the nature and they prevent the vertebral bones from grinding each other. Cartilage does the main function where it prevents the bone from grinding. Cervical vertebra is highly susceptible to degenerative process due to large range of motion. Mostly the cervical spondylosis occurs due to large degenerative processes due to which the vertebra gets degenerated. Next, Shubham, next slide, please. Your slide नहीं change होना. Okay. So main functions of cervical vertebra are protection of spinal cord, shock absorber, permit mobility of neck, and house for spinal cord. In this picture, you can see that the white part is the cartilage, which act as a which prevents the grinding of the bones, and these arrangements are cervical vertebrae, which are arranged one above the other. In between, the cartilages are present. Next. So blood supply to the cervical vertebra is through a vertebral artery. Nerve supply is through 8 pairs of spinal nerves emerging from spinal cord in the area. They are designed from C1 to C8. Next. Causes. So now we are going to deal with the causes of cervical spondylosis. As Shubham has already told you that bad postures are the main reasons for causing of cervical spondylosis. So bad postures due to soft chairs and couches, injury, especially to the neck, improper lifting of weight, stress and strain caused by sitting for longer period of time. If you sit for a longer period of time, it will cause stress and strain on your back, which is vertebra. Incorrect nutrition and psychological strain, body type and lifestyle, work pressure and strain, work pressure and strain. No indoor physical activity is allowed in the cervical spondylosis. Next. Slide नहीं change हुआ है शुभम. Sorry for the inconvenience, all of you. Okay, sign and symptoms. So we are going to deal with sign and symptoms, which shows that you are suffering from the cervical spondylosis. For most of the people, cervical spondylosis causes no symptoms. That means it shows no even if you have cervical spondylosis, there will be no symptoms. When symptoms do occur, they typically include pain and stiffness in the neck. The main sign and symptom of the cervical spondylosis is pain and stiffness in the neck. Tingling, numbness sensation is where you don't feel any kind of sensations. Weakness in your arms because it is the disease of spinal cord and of cervical vertebra. Lack of coordination and difficulty in walking, loss of bladder and bowel control. These are the signs and symptoms of the cervical spondylosis. Next. Treatment. Now, treatments include anti-inflammatory drugs. Anti-inflammatory drugs mainly prevents the inflammation. Painkillers which prevent the pain, muscle relaxant, cervical collagen, physiotherapy, surgical treatment,
So we are going to revise it again. For treatment, we are providing anti-inflammatory drugs, which will help to decrease the inflammation, painkillers, muscle relaxant, cervical collars, cervical traction, physiotherapy, and some surgical treatment can be provided to the patient of cervical spondylosis. Next is prevention. After learning the treatment, now we have to follow some preventive measures. So first is regular exercise. Regular exercise important in order to avoid the cervical spondylosis. The best exercise are swimming, walking, or yoga. Limiting activities that put pressure on the head, neck, and shoulder. We have to limit the activities which makes pressure on the head, neck, and shoulder. In order to avoid the ease of cervical spondylosis, we have to follow some good posture, that is while standing, working, or at the computer, driving, and sleeping. So first is proper posture while using computer. While using computer, we have to follow some points like we have to keep the monitor at eye level so that neck is at comfortable and straight level. This allows the cervical vertebra to remain in a neutral position and prevent the cause. Like in the picture, you can see there is a ideal position for the decks, that is 24 to 30 degree, which is an average dex height, so that it will help to maintain the proper eye level to talk to the monitor. Thanks. Second, those with sedentary occupation should take a break to stand up and every hour. Sedentary occupation, like people who are working on whole day on computer, so is of cervical spondylosis. Third is soft cushion sheet should be avoided and position should be changed as possible. Like most of the people, as you have already seen, that most of the people use cushions on the back of their chair in order to, so that they should not feel back pain or the back pain. Third is firm mattress and thin pillow should be used. As you know, never to bend from the waist down to lift any objects, but instead squat close to object, bending the knees but keeping the back straight and stand up slowly. There are certain suggested body position. First is lying. Like we should not lie on the stomach. Be sure to keep neck in a straight line with your body when you sleep. As you can see in the pictures as shown on the monitor. Like we should not sleep on our stomach side. We should sleep straight in such a position that our neck should be in a straight line with our body. While sitting, we have to sit in such a manner that while performing, we should avoid sitting for long period. Both the head and neck turn to one side. For example, it should not be bent forwards. Modify desk height or chair to suit your need. Like according to your height, you should modify your height of desk and chair. While standing, move chin in, pull stomach in. Do not slouch, do not bend forward for long periods. Like while standing, there are certain key points we have to keep in mind, like chin should be moved in, stomach should be in, we should not slouch, we should not bend forward for longer periods. There are certain kinds of exercise, like first exercise, perform the earlier suggestion about the correct sitting position. Like we have seen in previous slide about the suggestion, what suggestion we have to follow while sitting, standing, and lying. So we have to follow up that things. And third is chin should be tucked in. The shoulder should be slightly back and down. Gently draw head backwards. Like your head should not be full backward or full outwards. It should be in a proper manner. Like it should be in a gentle backward. Keep looking ahead. You have to look ahead so that your posture will be maintained correctly. Be sure to keep body posture straight and tall during the exercise. Like you should be sure while doing exercise or while walking, your body posture should be in a straight manner. Second exercise, as you can see in the picture, that is move left ear to your left shoulder. As you are able to see in the picture, change position, do it for 8 to 10 times. Like in order to ease the burden of cervical spondylosis, there are certain exercises, and this exercise is one of the best exercises because it will help to remove the pain from the neck. Third is move chin to your chest. As you can see in the picture, that you have to move your chin to your chest level, and then lift your chin up and lean head backwards. This you have to repeat for 8 to 10 times. Fourth exercise, that keep your body in a correct posture. Move head to look over right and left shoulder. Change position. Repeat the movements for 8 to 10. At 8 to 10, as we do this exercise in our academic in your school times, that we have, in order to ease the burden of cervical spondylosis, we have to the pressure on the neck should not fall directly. So in order to remove that burden, we should follow these exercises. Fifth exercise is lift shoulder towards ears and relax shoulders down. Like as you are able to see in the picture, in the same manner you have to do this and you have to repeat for 8 to 10 times. Now, after prevention, what all are the diets we have to follow which will help to ease the burden of cervical spondylosis? Like in our diet, it should contain fish, nuts, oil seeds, apple, garlic, ginger, turmeric, fruits, soups, vitamin C, vitamin D, phosphorus are essential for bones. What are the things we have to avoid in your diet? They are like fatty foods, fried foods, sour curd, sugar, tea, coffee. This all are the things which we have to avoid in our diet. Now next is massage. Like what massage we perform? Like we have to give a mild oil massage to the neck, shoulder and hands. We have to use a hot application for 5 to 10 minutes twice a day, as you are able to see in the picture. Conclusion is that a cervical spondylosis is a degenerative disorder, as you came to know about from our slides. That is it is the incidence of cervical spondylosis is increasing day by day, as we all are focusing on the lectures through online, as we are also conducted this lecture through webinar only. So the main cause of this disease is the changing of lifestyle and bad living habits. So what we have to do, we have to change our lifestyle and we have to control our bad living habits. Early diagnosis and treatment is necessary for the prevention of complication of cervical spondylosis. Has to prevent from any complication, early diagnosis and treatment is necessary. Thank you.
This is about this topic. Anyone have any doubt regarding the cervical spondylosis? They can ask. I will try to solve problems. Yes, am I audible?
Yes, you are audible.
हाँ, किसी को कोई डाउट है तो पूछ सकता है, कोई प्रॉब्लम नहीं. ज्यादा करके गर्ल्स में डिसीज ज्यादा देखा जाता है इंडिया में, ड्यू टू सेक्स हार्मोन ऑफ गर्ल्स, दैट इज प्रोजेस्टेरोन एंड एस्ट्रोजन. तो गर्ल्स को ज्यादा केयर लेने की जरूरत है. इफ एनीवन हैव एनी काइंड ऑफ बैक पेन और मोस्टली नेक पेन, शोल्डर विच इज सर्कुलेटेड थ्रू द शोल्डर, उनको डॉक्टर को सजेस्ट करने की जरूरत है. Because this is non-treatable disease, you can just prevent it, but you cannot cure it completely. That's why awareness of this disease is important. Like HIV, hepatitis B are non-treatable disease. Our medical field is not that much advanced yet to resolve such problems. Because of that, awareness camps are important for such topics. If anyone don't have any doubt, then we will end the session. Okay.
So as we come to an end of the session, I would like to thank all the three of our guest speakers. Thank you for such an amazing yet informative seminar. And we will try to improve our habits in our everyday life and inculcate healthy habits within us. I would like to thank respected Principal Ma'am, Dr. Manjusha Deshmukh, Deans, HODs, and teachers of all the departments, and also our PO, Dr. Sunita Palman, for her immense support and guidance throughout the event. Also, thank you to all the participants for patient listening.